toll not only on the health of individuals, but on families, economies, and societies. Joint action between affected communities and the health system are critical to bringing this ancient killer under control.
To end TB, meaningful community engagement is necessary to acknowledge the strength and the aspirations of the communities affected and infected with TB, and even TB survivors.
Harnessing the experience, skills, and insights of affected communities allows for better tailoring of programs and interventions, making them more community-centered and context-specific.
The most crucial step in an effective TB response is identifying who your community is, because they have the highest risk and are most vulnerable to TB, and because their voices and contributions can help curb the TB pandemic.
Meaningful engagement means that community members are valuable partners in the TB response. Decision-making must include an informed member of the community who bring lived experience and reality to the table.
Meaningful engagement requires intentional, deliberate be included from planning throughout the national TB program cycle, including monitoring and evaluation. Creating or maintaining strong platforms and networks and coordination will be key.
The guidance is co-created with representatives of civil society, communities affected by TB, national TB programs, and other partners. It is a major tool that ministries of health, their national TB programs, NGOs, and other community groups can consult to harness the power of local communities to prevent, treat, and end tuberculosis wherever they are. Yes, we can end TB together.
What are you banging up there?
Just a cough.
Just?
Man, I have had this cough for more than 2 weeks now. It's not going. I also sweat a lot at night. I have lost weight. There's no clear explanation.
2 weeks. Have you gone for a checkup?
No.
You can easily beat TB.
I have no what's wrong. I don't have money.
Money for what? TB services are free and available in all government health centers. No?
Yes, anyone can get TB. But the good news is you can live a TB-free life. If you've been coughing for 2 weeks or more, have lost appetite and weight, sweat a lot at night, you could have TB. Visit a health center near you for TB testing and more information on how to prevent and manage it.
Let me work on the cards that I work on YouTube.
Obulemu, brought to you by the Ministry of Health with support from USAID.
TB is one of the world's deadliest infectious diseases that takes a huge toll on the health of individuals. And in 2022 alone, over 1.3 million people worldwide died from TB, and 7.5 million were diagnosed with TB.
And for over 5 contacts, TPT, we came from 27.5 to 60.5. So this is some significant progress.
I thank you for the opportunity to participate in this conference with such a befitting theme: advancing science, finance, and innovation for accelerated TB and leprosy response to urgently end the TB epidemic and achieve zero leprosy in Uganda.
As we continue to deliberate and to take this opportunity to declare the 6th Annual TB and Leprosy Stakeholder'S Conference officially open for God and my country.
I think we are not tapping enough out of this TB program.
I'm wondering whether they have translated material that can be able to guide the audiences that it's actually live TB-free, not live TB-free.
The number of clients we identify and reduce. There is no need to start them on treatment before you realize the next time you are going to check on them, anywhere is.
So we still have that challenge of these people to take this.
She has been very good.
My name is Dr. Tuya Westavia, the Assistant Commissioner in charge of Tuberculosis and Leprosy Control at the Ministry of Health, Uganda. TB is one of the infectious diseases that our country is dealing with. High burden country as classified by the World Health Organization with an estimated incidence of 196. This is a drop from 200 that we have had over the last 3 years. It is this year that we have had a drop of 2.7% in our TB incidence, which translates to about 90,000 Ugandans falling ill with TB every year. As a country, we are able to identify a good number of these people that fall ill with TB. The most recent financial year that we concluded in June, we were able to reach over 84% of all those who were ill with TB, the highest also that this country has ever achieved, which is very good progress that the country is making in reducing the burden of those people that fall ill with TB that are not identified and started on treatment. We had a shock in the first lockdown, and the access to TB services was affected because of restrictions in movement and so many things that were put in place for the control of COVID-19. Following the gradual release of the lockdowns in March starting July, we started to see recovery of TB services with an improvement in the number of people that were getting onto treatment. The quarter April-June 2020 was the worst hit period in terms of people not accessing TB services, with a coverage of around 64% among those whom we expected to find. But in the quarter starting July 2020 up to the quarter of April-June 2021, we see the coverage has gradually improved among those that we expected to see, to the highest that we saw by the end of the financial year of 84%. So there's been progress, and thanks to the health workers out there who have been resilient in terms of making sure that they keep screening people who come to the health system. But also as a program, we put in place interventions and guidance to enable the health workers to offer the quality services and make it more accessible to the people during the pandemic. We realized that it was not easy for people to move from the communities to the health facilities, given the transport hikes and restrictions in movement. So interventions to integrate activities at community level, screening, and
may I have your attention, ladies and gentlemen?
These have helped us to recover in terms of reaching more people.
Thank you so much, and I'm welcoming you back from the coffee break.
People with TB on treatment.
We have to resume
in this area despite the COVID-19 pandemic, and our treatment success has.
Okay, thank you very much. I want to welcome you back from the break, and we need to resume our conference. I know some of our colleagues are still coming in, but in the interest of time, allow me to invite the session chair.
Online.
And our online colleagues, we want to apologize. We never gave you the opportunity to present your questions and your comments. But as we move forward, we shall be able to give you that opportunity because we have another plenary session. But at this juncture, allow me, ladies and gentlemen, to invite the session chair, Professor Moses Joloba. Let us welcome him with a round of applause. Professor Moses Joloba will tell us the different people who are going to present to us. But I also understand he has his own presentation to make. So I don't know whether it's going to come first or will come last. So please, Professor Joloba, sir.
So the chair keeps standing here, not? Thank you very much, MC. Colleagues, let's take our chairs. Let's come in. Please make those people outside there come in for a very interesting session. This session, of course, part of it has been taken care of. Okay. Oh. Is it? This is next. This is backward. This is pointing. Oh no, it's not me presenting. You can put the presentation down. You are just making an advert for me, but I think this session is about science and innovative approaches to ending the TB epidemic and achieving zero leprosy in Uganda. And as the title goes, is a very interesting sub-theme of science and innovation. And I like it because people going to present do believe in ending this epidemic as soon as possible. And I have 5 presenters. Dr. Sabrina Kitaka from Makerere University, Mulago Hospital.